patients really are not doing what they need to do, which is we want to be sure that they're walking and that they're walking a lot. And so that creates a major challenge. This is data from one of our patients, so I thought I share this. This is a project that we are carrying on. Dr. Chow, who's the lead researcher in this project, decided to measure the number of steps for all inpatients in our units. And what she found is that really patients walk very little. You can see that this patient on day 19 was walking 557 steps in a whole day. And remember, there's supposed to be an intensive rehabilitation program. That's what an inpatient program does. So we clearly can attest that these patients are not getting as much. And of course, what ends up happening is you're in an average, when we looked at a bunch of patients, you're walking less than 500 steps in a day. Not really conducive to all of the things that we need to do in neurorehabilitation. So when you think about a locomotor training program, you need to think of this as a method that specifically and repeatedly promotes the desired outcome. In this case, if I'm using the lower limbs, is to really promote walking. And when you do that, you have to keep in mind that there are three major potential limitations. One is that it requires multiple therapists to carry it on. Two, it's usually limited by the endurance of the therapist, not by the endurance of the patients. And if you can have a therapist sustain that for 10 or 15 or even 20 minutes, usually is very difficult to do. And therapists can get injured. They're doing all sorts of incredible things. And so this is an example of locomotor training program at MossRehab. And so you have 3 therapists working with this single patient. You can see why I say that therapists can get injured. There is a lot of effort. You know, when I look at tapes like this, I always wonder who's really doing the exercise here, the patient or the therapist. And so in my perspective, robotics and rehabilitation are perfect tools because they have really very specific characteristics. So they are very appealing because they can provide well-defined repetitive functional exercises. You can do that in a consistent and prescriptive manner. The robotic devices can be used really by individuals who have severe weakness. And so they can provide the assistance that the patients need. They can be progressively in increasing demand and complexity of task. And they can be adaptive to the patient needs. And we'll talk about the adaptability in just a second. And then they can be engaging, and in that case, even reduce discomfort because the patients keep really engaged in the activity itself.
This has been a highlighted clip from ReWalk's Topics in Neurorehabilitation web series. To watch the full episode, please go to the ReWalk Robotics YouTube page or visit the link in the comments below. See you next time.